MHO, Omega Holdings Organization, is very concerned on anxiety disorder and everyone matters. Mental health conditions are not to discriminate because it can happen to all people from all walks of life, from professionals to students, parents and children.
Hold me close till I get up. Time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
Statistics has shown us a total of 638 suicides were reported in Malaysia between January and July this year. With the boost of COVID-19 and implementation on lockdown or movement control order (MCO), an increase of 140% over the same period last year based on Director General of Health Tan Sri Dr. Nur Hisham Abdullah. He said in a statement in conjunction with World Suicide Prevention Day, the symptoms are such as heart beating fast, the breath become congested, and the body sweats that come suddenly until the patients feel suicidal. The problem of extreme anxiety is often hotly debated. Extreme anxiety refers to a situation whereas a person will be overly worried about trivial things, whereas in a sane mind, it can be resolved easily. Among the spectrum of the disease is a panic attack, in which the anxiety appears suddenly.
The type of anxiety disorder is including our generalized anxiety disorder (GAD). With GAD, you may feel extreme and unrealistic worry and tension. Even there are nothing to trigger this feeling, most days you may worry a lot about a various topics, including our health, our work, school and relationship. The physical system of GAD can include our restlessness, difficulty concentrating and sleeping problem. Number 2, the panic disorder. The feeling of terror may start suddenly and unexpectedly, or they may come from a trigger like facing a situation of threat. A panic attack can resemble a heart attack. If there is any chance you experience a heart attack, go to the emergency room. If better to err from the side of caution and have a healthy care professional check you. During a panic attack, you may experience our sweating, a heart palpitation, feeling like your heart is pounding, chest pain, and lastly is feeling of choking, which can make you think you are having a heart attack of going crazy. The panic attacks are very unexpected. People with panic disorder often spend of time worrying about the next panic attack. They also try to avoid situations that might trigger an attack.
Hi, I would like to share about phobias. Did you know the meaning of phobias? Phobias are an intense fear of certain situation or object. Some of these fears may make sense, such as fear of snake. But often, the level of fear doesn't match the situation. Like with other anxiety disorder, you may spend a lot of time trying to avoid situations that may trigger that phobia. A specific phobia or simple phobia is an intense fear of particular object or situation. It may cause you to avoid everyday situation. Some specific phobia include fear of animals such as spider, dog, or snake. Fear of blood, fear of flying, fear of height and injection. Other things is social anxiety disorder. Healthcare provider used to call this condition is social phobia. You may have overwhelming worry with your daily social situation. You may worry about others judging you. You may be anxious that you embrace yourself or open yourself to ridicule. People with social anxiety disorder may avoid social situation entirely. Next is agoraphobia. If you have agoraphobia, you may have an intense fear of being overwhelmed or unable to get help. Usually, you have a fear two or more of this environment. Firstly is enclosed spaces. Number 2 is line of crowded. Number 3 is open spaces. Number 4 is place outside your house. And last is public transportation. In severe situation, a person with agoraphobia may not leave the house at all. They are so terrified of having a panic attack in public that they prefer to stay inside.
Okay, what is separation anxiety disorder? This condition mostly happens to children or teens who may worry about being away from their parents. Children with separation anxiety disorder may fear that their parents will be hurt in some way or not come back as promised. It happens a lot in preschoolers, but older children and adults who experience a stressful event may have separation anxiety disorder as well. Okay, how common are anxiety disorder? Anxiety disorder are the most common mental health conditions. They happen to nearly 30% of adults at same point. Anxiety disorder most often begin in childhood, adolescence, and or early adulthood. Okay, how do anxiety disorder affect children? It's normal for children to feel some amount of anxiety, worry, fear at certain points. For example, a children may feel scared of a thunderstorm or barking dog. A teenager might get anxious about an upcoming test or school dance. But sometimes the children approach this situation with overwhelming dread, or they can stop thinking about all the fears tied to one of these events. It may seem that none of your comforts help this student. You can prevent anxiety disorder, but you can take some steps to control or reduce your symptoms. Okay, number 1, check out medications. Talk to healthcare provider or pharmacist before taking over-the-counter medications or herbal remedies. Some of these contain chemicals that make anxiety symptoms worse. Number 2, limit caffeine. Stop or limit how much caffeine you consume, including coffee, tea, cola, and chocolate. Number 3, live a healthy lifestyle. Exercise regularly and eat a healthy, balanced diet. Number 4, get counseling and support if you experience a traumatic or disturbing event. Doing so can help prevent anxiety or other unpleasant feelings from disrupting your life. Number 5, get educated. Learn about the specific type of anxiety disorder you have so you feel more in control. Help friends and loved ones understand the disorder as well so they can support you. And second last, Limit or avoid caffeine. Like I said, many people with anxiety disorder find that caffeine can worsen their symptoms. And finally, talk to your healthcare provider. Your provider is your partner in your care. If you feel like treatment is not working or have question about your medication, contact your provider. Together you can figure how the best move forward. Thank you.
It is normal to have some anxiety. You may feel anxious or nervous if you have to tackle a problem at work, go to an interview, take a test, or make an important decision. Anxiety can even be beneficial. For example, anxiety helps us notice dangerous situations and focus our attention so we stay safe. But an anxiety disorder goes beyond the regular nervousness and slight fear you may feel from time to time. An anxiety disorder happens when anxiety interferes with your ability to function. You often overreact when something triggers your emotion. You can't control your response to situations. Anxiety disorder can make it difficult to get through the day. Fortunately, there are several effective treatments for anxiety disorder.
If your provider finds no sign of physical illness, they may refer you to a psychiatrist or psychologist. These mental health professionals specialize in diagnosing and treating mental illness. They may use specially designed interview and assessment tools to figure out if you have an anxiety disorder. Typically, they provide based on diagnosis on number 1, you report symptoms, including how intense they are and how long they last. Number 2, discussion of how the symptoms interfere with your daily life. Number 3, they provide observation of your attitude and behavior. Provide also consult the Diagnosis and Statistical Manual of Mental Disorder, DSM-5. The American Psychiatric Association published on the DSM-5 is the standard reference manual for diagnosing mental illness.
So, how to manage and treatment for the anxiety disorder? Firstly, you can will it away. It's not a matter of self-discipline of attitude. Research have made a lot of progress in the last few decades in treating mental health condition. Your healthcare provider will tailor a treatment plan that works for you. Your plan may combine medical and physical therapy.
I would like to continue about how does medication treat anxiety disorder. Okay, medication can cure an anxiety disorder, but they can improve symptoms and help you function better. Medications for anxiety disorders often include anti-anxiety medications such as benzodiazepines. May decrease your anxiety, panic and worry. They work quickly, but you can build up a tolerance to them. That makes them less effective over time. Your healthcare provider may prescribe an anti-anxiety medications for the short term. Then taper your off, or the provider may add an antidepressant to the mix. Antidepressants can also help with an anxiety disorder. They tweak how your brain uses certain chemicals to improve mood and reduce stress. Antidepressants may take some time to work, so be patient. If you like to stop taking antidepressant, talk to your provider first. Next is beta blockers. Beta blockers is a class of drugs which present the stimulation of the adrenergic receptor responsible for increased cardiac action, used to control heart rhythm, treat angina, and reduce high blood pressure. So beta blockers usually used for high blood pressure. It can help reduce some of the physical symptoms of anxiety disorder. They can relieve rapid heartbeat, shaking and trembling. Your healthcare provider will work with to find the right medications, combination and dosage. Don't change the dose without consulting with your provider. They will monitor you to make sure the medicine are work without causing negative side effect.
Other things is how does psychotherapy treat anxiety disorder. Psychotherapy or counseling helps you deal with your emotional response to the illness. Mental health provides talks through strategies to help you better understand and manage the disorder. Approaches included exposure therapies, focuses on dealing with the fear behind the anxiety disorder. It's help you engage with activities or situations you may have been avoiding. Your provider may also use relaxation exercise and imagery with exposure therapy. Second approaches is cognitive behavior therapy, CBT. It's the most common type of psychotherapy used with anxiety disorder. CBT for anxiety teaches you to reorganize thought patterns and behaviors that lead to troublesome feelings. You then work on changing them.
Living with how can I best cope with an anxiety disorder? There are several steps you can take to cope with an anxiety disorder symptoms. These strategies can also make your treatment more effective. Explore stress management. Learn ways to manage stress, such as through meditation. Join support groups. These groups are available in person and online. They encourage people with anxiety disorders to share their experience and coping strategies.
On mental health awareness campaign at UniKL Malaysian France Institute with the collaboration from English department, the company going to hosting an event by organize a mental health resources fair, host on Instagram, Facebook and Twitch live program about suicide prevention and sponsor a e-sport, fun run, walk or rally. By all this event, this will create an atmosphere of acceptance, acknowledgement and understanding towards people suffering from an anxiety disorder. We believe that the part of being human is about helping each other. Not to forget, you can contact us at Facebook, Twitter, Instagram and WhatsApp or call on the hotline.
Waiting all my life, and it was right before my eyes, watching all this time